Well, hello there. This is Skip McCoy with RiverSoft, and today I'm talking about home healthcare interventions, and specifically how RiverSoft implements interventions. In RiverSoft, interventions are grouped into pathways. They're used on the start of care, resumption of care, and research to create a patient's care plan. They're ranked by ADL outcome and presented to the caregiver for selection via the Outcome Ranked Interventions Browser, or ORB. Interventions are documented during a typical visit note and can be specifically related to particular pages on the note. Interventions drive the treatment and documentation of wounds. Interventions trigger alerts for vital signs out of range. And interventions prevent patient discharges without goals being properly documented. So let's start with talking about how interventions are grouped into pathways. And this is an example pathway. COPD knowledge deficit. A pathway is simply a group of interventions. Each intervention has a goal. There are at least 6 common types of pathways, ways of grouping interventions. Interventions to address a problem related to a diagnosis, like these depression interventions, these diabetes interventions, these heart failure interventions. Common interventions for a particular clinical skill. For instance, general MSW, general nursing, general OT. Interventions to address a general problem, like here, fall prevention, fall risk. Interventions to address patient goals. Another type of grouping interventions is to adhere to specific physician protocols. Certain physicians want a certain way they want their patients taken care of for certain situations. And finally, there are wound treatment interventions. So there's at least 6 different ways of grouping interventions into pathways. A pathway can be related to diagnosis codes. This allows the note analysis feature to provide guidance regarding the relationship between the note, the pathways used, and the diagnosis codes used and not used. A pathway can be related to note pages. Note pages related to a chosen pathway are automatically added to the note and annotated with a P, showing that the page is not normally a part of the note, but was added because its associated pathway was added to the patient. A pathway may be related up to 5 key measurements, which is down here. The note analysis feature will prevent the completion of a note if a pathway required measurement is missing. Be careful to only list measurements that are vital to the successful outcome of the pathway because you are forcing it to be measured on every note. Each intervention will have a status when it's associated with a patient. That status will be either ongoing, met, or not met. Each subsequent note that is created inherits a copy of every ongoing intervention from the previous note. For example, a PT note will inherit all the PT interventions, an OT note will inherit all the OT interventions, etc., except the SN note, which inherits every intervention, because the SN is kind of like the captain. The point of the pathways is to provide the visiting caregivers with a clear nursing and therapy care plan that every caregiver can quickly update on every note. When an intervention's goal is met, it is marked as met and will not be carried forward to subsequent notes. It will be readily visible in the lookback, but will no longer be part of the active interventions. At that time of discharge, every intervention must either be marked as met or not met, accompanied by narrative of why the goal was not met. By using clinical pathways to frame the patient's care plan, 4 important qualities are added to an agency's electronic medical record keeping. A comprehensive, custom care plan can be quickly created for each patient. Each caregiver visiting the patient can quickly update the progress made toward the care plan's goals. Each discharged patient is guaranteed to have every goal of every intervention either met or documentation providing the reason it was not met. And finally, interventions used on past patients can be mined, examined, and ranked by their outcomes, providing caregivers with the ability to see interventions used in the past on like patients that had good outcomes. This is the Outcome Ranked Interventions Browser feature, which I'll show you in just a little bit. Okay, this is how interventions are used on start of care, resumption of care, or recert. Once the nurse therapist has completed the assessment portion of the clinical note, The appropriate interventions are chosen using the Patient Pathways Editor. And that is achieved right here. This is the Patient Pathways Editor, and this is directly from the 45 on a note. What they'll do is click on this Multi-Select Interventions button, and they'll go look at all the interventions in the library. The selected interventions and goals become the core of the patient's care plan and flow to the 45 for the doctor's signature. Once the nurse or therapist completes the note is reviewed and diagnosis codes added. Once the diagnosis coding analysis is done, the reviewer then sends a note back to the author for review. Because the coding is done, the Outcome Ranked Interventions Browser, or ORB, can now be used. To use the ORB, the patient's episode must be diagnosis coded, and the OASIS questions MU 1033 and MU 1800 through MU 1860 must be completed because this information is crucial in finding like patients and ranking their interventions. Okay, let's talk about the ORB for a little bit. The ORB is accessed by the small blue spherical button to the left of the Multi-Select Interventions button. It's an alternative way of selecting interventions for the patient. Each intervention is ranked by the improvement in ADL scores it helped produce on all patients on which it was utilized. So clicking this little blue button brings the ORB up, and the ORB is nothing more than a browser of outcome-ranked interventions. The current patient's sex, age, smoking, and obesity status, clinical group, functional group, and comorbidity status is shown at the top of the screen. The clinical group is the clinical group that the patient's primary diagnosis code falls in. There are 12 clinical groups, A through L. The clinical group is used as the PDGM HIPS position 2. The functional limitation group, A low, B medium, and C high, is related to the answers to MU 1033 and MU 1800 through MU 1860 on the start of care OASIS. The functional limitation group is used as the PDGM HIPS position 3. The comorbidity indicator, 1 no, 2 low, 3 high, considers all of the patient's secondary diagnosis codes to determine the level of comorbidity. The comorbidity indicator is used as the PDGM HIPS position 4. The next group of fields is labeled Only Consider Patients Matching This Clinical Profile. It defaults to the current patient's settings. To see interventions for a broader pool of patients, change the selection fields to broaden the scope of the search. For example, change the age from 5 years max difference to 10 years max difference, and you'll get more patients from which to search interventions for. Currently, only the overall ADL outcome is used to rank interventions. This outcome value is computed from the sum of the differences between the ADL OASIS discharge and start of care elements, MU 1800 through MU 1860. The ADL score is the average ADL improvement score achieved by the intervention on all patients on which it was utilized. The fall score is the average of the falls data in the OASIS elements MU 1900A through MU 1900C. And the ER visits is the average of the emergency room visits indicated by OASIS element MU 2301. By default, only the top 40 interventions are shown, ranked by their ADL improvement score. By clicking on the pathway's name on an intervention, the screen shows at the bottom the patients that intervention was utilized on and why that intervention is showing in your list. And it's showing in your list because that intervention was used on this patient, and this patient matches your clinical indicators right here. Now, you just look at all the interventions, evaluate the needs of your patient. Look at these because these are very high performing interventions. And if one of these fits your patient, by all means use it because statistically speaking, you're going to have a better chance at improving your ADL score for this patient. By clicking on the intervention, you have chosen it. When you get out of the screen, by clicking the X, you've assigned all the selected interventions to your patient. Pretty simple to use. We have begun work with outside researchers to create a standardized set of outcome-ranked interventions. We hope to make this available to our customers soon, later this year. This will allow smaller, newer agencies with little or no outcome history of their own to access outcome information compiled from a larger pool of patients from other agencies. RiverSoft and our research partners will continually improve and update the outcome ranked intervention data and provide those updates to our customers on a quarterly basis. Okay, that was all about the start of care and getting a care plan up and running for a patient. Let's talk about how the interventions are documented on a typical note. Okay, on a typical note, any pages that appear with a P show that that page is related to a pathway. So you can update the interventions from any page by clicking on the pathway button on that page, or you can click on the button right here, the interventions page, and look at all the interventions regardless of how they're related to pathways and body systems. So, for instance, if you're on the depression page and you click the pathways button, that invokes the interventions editor, but it only shows you the interventions related to the pathways for depression. So it really narrows down the list. The status of the intervention's goal is updated right here, and the narrative is entered right here. If you click the next page button, that's going to take you back to the depression page. Pretty simple. Okay, how interventions drive the treatment of wounds. This is the body diagram, and this is where the wounds are documented. Each wound is automatically assigned a number. Each wound includes a wound assessment area. Each wound has a unique goal and intervention. Narration can be added and the status updated on every note. The snapshot, which is accessed right here, provides a summary of all the wound assessments on all the previous notes, while the pathway lookback shows the treatment history of the wound on all previous notes. So here's an example of the snapshot. And this is a legend right here. And then these are the notes from most recent all the way back in history with the observation of wound number 1. This is the pathway lookback showing the narration for the wound from 8/9 all the way to the current time. And there's all the narration. And finally, the goal for the wound was met at the very bottom. Okay, next, how interventions trigger vitals or out of range alerts. RiverSoft provides alerts whenever a vital sign falls out of range. In order to use this feature, you first have to set up a vital signs management pathway in your system. They probably all have the same goal, but you'll set up an intervention for blood pressure, blood sugar, oximetry, pulse, respiration, weight, and temperature. The ranges are delineated by a less than sign and square brackets and a greater than sign and square brackets. So you only have to do that one time. Then on the patients on which you want to do the range checking, you simply choose those interventions and complete the lower and upper ranges. Pretty simple. Then on the notes for those patients, you can do a range check at any time from the vital sign page. And the note analysis will always tell you if you're busting one of the ranges. Now, if you bust a range, you have to tell the doctor that the range was busted, and that's done by adding narration to the intervention. The system is going to check for this narration, and if you're missing that narration, you'll get this alert in the note alert, the note analysis. There's no narration for this intervention indicating the notification to the doctor. If the notification information is in the narration, then you won't get that portion of the alert. Okay, so that's range checking. Okay, finally, discharge. How interventions prevent patient discharge without proper documentation. Whenever you do a discharge note in RiverSoft, the note analysis, besides giving how you did on your STAR questions and how you did on key indicators in the OASIS, it also tells you if you've got any goals for interventions that are still ongoing and provide you a little alert here. You will not be able to discharge the patient without addressing these ongoing goals. You must either mark them as met or mark them as not met, along with documentation about why it was not met. So this prevents an auditor from coming in 6 months from now and looking at one of your discharged patients, seeing that you had all these goals lined up for the patient, and then there was not ending documentation for each goal. That's how RiverSoft protects you and keeps your EMR charts clean. Okay, well, that's a summary of the interventions feature in RiverSoft. It's a very powerful feature. I hope you use every aspect of the interventions, especially the new outcome ranked interventions browser. That will help you drive for better patient outcomes. We believe you can use that as part of your QAPI program, and we'll have instructions for that later. You can also use it in your marketing program, because there are probably not very many other agencies in your market that are using evidence-based medicine in their charting. Well, this is Skip McCoy with RiverSoft, signing off.